In August 2008, I paid a visit to Tanzania. Located in East Africa with a population over 40 million, this country's land size is 2.5 times larger than Japan. Since its independence in 1961, Tanzania is known for its political stability and high economic growth amongst the countries of the Southeast Africa. However, nearly 60% of the population are still forced to live on less than $1 a day. The Tanzanian government and the United Nations agencies have begun to work together for better development. The largest city in Tanzania, Dar es Salaam. As the economic centre of the country, the city has developed rapidly, which has also changed the people's living standards. However, the economic gap between the urban and the rural areas is widening. Rural population is largely left behind development. To reduce poverty, it is necessary to close the gap. With a 2-hour flight from Dar es Salaam, I arrived in Mwanza, the second largest city in the country. I'm here to visit solar photovoltaic project sites implemented by UNDP. This is one of the sites, Nyasaka Islamic Secondary School. In Tanzania, about 40% of the population are Muslims. Previously, the school had no access to electricity, so they depended on diesel generators. Shifting to solar PV was needed, considering the rise of fuel price and health problems caused by smoke and soot. Instead of fossil fuel, UNDP is promoting to introduce solar PV system. Clean and affordable energy allows students to study longer and step closer to their future dreams.
I want to be a lawyer, engineer.
Oh, yeah, that's great.
In Mwanza, 57 facilities have introduced a solar PV system so far. Katunguru Health Center is one of such facilities with support of UNDP's project. Thanks to indoor lighting, the center can deal with child delivery and provide treatment through night times. These achievements of the project are shared throughout the country and are encouraging people's future efforts. UNDP is not only supporting to ensure access to energy, but also to change the country and people's mindsets towards development challenges. Ensuring sustainable access to energy also improves people's livelihoods. This village was opened by the youth in the 1980s under the government policy for poverty reduction. Here, UNDP is working with the Global Environment Facility to promote utilization of renewable energy.
And then it's processed here.
Villagers have utilized biogas and rainwater and improved their livelihoods significantly. Now, they are working to share their experience with the young people of the surrounding communities.
I want what happened to me to happen to other young people across the country, to help others to transform their lives.
The UN has launched an innovative pilot initiative called Delivering as One. The initiative aims to facilitate greater cooperation among UN agencies and improve aid effectiveness to achieve the Millennium Development Goals. Tanzania is selected as one of the pilot countries under the initiative. Over 20 UN agencies are working together for better development.
UNDP works with all the other agencies together as one. Is very much our big challenge here in Tanzania, that the MDGs can only be done if we all work together. Development partners support, the United Nations united support to meet these goals.
HIV/AIDS is a serious problem also in Tanzania. the prevalence rate of HIV is high as 5.8% of the population. This Temeka hospital in Dar es Salaam is the foundation hospital of the district. It provides care and treatment for infectious disease, including tuberculosis and HIV/AIDS.
今一番心配なことは何ですか？何が子供に感染してないかというのが一番心配です。
Within the framework of Delivering as One initiative, UNDP has worked with other UN agencies to support transmission prevention, treatment and counselling.
The hospital itself, which provided the health service, benefited from the assistance, and also communities who have been assisted about the awareness of the HIV/AIDS.
UNDP's responses to HIV/AIDS include supporting livelihoods of the families and communities of the people living with HIV/AIDS. Each UN agency has collaborated to combat HIV/AIDS based on its expertise. UNDP has supported income generation of the people living with HIV/AIDS through providing vocational training, which enable the people to live as a member of the society. Development challenges may vary from poverty to HIV/AIDS, education and energy. It is necessary to tackle these challenges simultaneously to achieve the Millennium Development Goals by 2015. Through this visit, I strongly recognise that we must work as one.